This is a training video to assist providers in the treatment of weight loss through weekly injections. There are two medications commonly used in this realm of weight loss treatment. They are referred to by several names. Ozempic and Wegovy are trade names for semaglutide. Ozempic has been available to diabetics for years. And in 2021, Wegovy was released for weight loss. Same medication, just a different name. Mounjaro is also a GLP-1 agonist. And Mounjaro and Zepbound are trade names for tirzepatide. Zepbound was released in the fall of 2023 for weight loss. Same medication as Mounjaro and tirzepatide. Both medicines are commonly not covered by insurance and can cost up to $1,000 per month or $1,000 or more per month in their trade name forms. Both medications, as mentioned, are GLP-1 receptor agonists, and they work by increasing insulin production and lowering glucagon secretion. It also works on areas of the brain that affect our appetite and cravings. Because it slows transit of food through the digestive tract, patients feel fuller eating less, and this sensation of fuller lasts longer between meals. Semaglutide has been shown to decrease inflammation in the body and improve fat lipolysis. Just earlier today, I had a patient follow up on the medication, and they were very happy about their decreased back and joint pain, possibly just related to weight loss, but also maybe related to this anti-inflammatory effect. Tirzepatide has a dual mechanism of action, an added GIP receptor, which allows it to continue to do the same as the semaglutide, but has an improved ability to lower A1C, improve insulin secretion, and decreased glucagon secretion. Studies indicate patients can lose up to 13% of body weight on semaglutide and up to 18% on tirzepatide. Benefits of semaglutide include decreased appetite, decreased cravings, weight loss, and improved blood sugar control. The benefits of tirzepatide are the same, but also that added lowering of the A1C and improved cardiometabolic measures. Side effects most commonly include nausea, vomiting, and constipation, but sometimes people will have acid reflux. They'll talk about belching and burping. They call them the sulfur burps. You may hear that term. And they can have abdominal pain and diarrhea. Contraindications, there's just two contraindications. Absolute contraindications are a personal or family history of thyroid medullary carcinoma. There are forms of thyroid cancer that are more common. Those are not a contraindication, the specific thyroid medullary carcinoma. And multiple endocrine neoplasia type 2. When you ask patients about this, they usually say, "What?" They don't have it. If they have a history of chronic pancreatitis, you might want to use some extra caution. Other things to consider are episodes of hypoglycemia, if they're having those prior to getting on the medication, if they've got kidney disease, or if there's a potential for an allergic reaction. Cost of the medication, let's talk about dosing first. I'm going to refer to some information sheets provided by Strive Pharmacy. And when you get your portal set up through Strive, I would encourage you to also reach out to them. I can give you their contact information to get their pricing sheet. Here's what it looks like for their semaglutide sheet. It talks about these side effects, dosing, and provider and patient pricing. Usually when I start somebody out, if they're semaglutide naive, I start them out at 5 units per week. After a couple weeks, I have them automatically go up to 10 units per week, and then I follow up in 8 to 12 week time period to see how they're doing. Strive will say, let's get them up 5 units, 10 units on a regular basis. 20 units, 35 units, 50 units is the max. But I like to start them out real low and slow and then just see how they're doing. If they're losing a pound or two a week, I think that's good and healthy. Another thing to mention is that with these medications, people need to be advised that they will lose muscle mass with it. And they can offset this by making sure they're eating the proper amounts of protein and doing some weight resistance exercise. Of course, I counsel the patients to consult with a dietitian and try to make other lifestyle changes that will assist them. But this medication is successful with them taking it and not doing anything else in their life. So semaglutide, 5, 10, 20, 35, 50 units. Those are the different doses. Those respectively equate to 0.25 milligrams, 0.5, 1 milligram for the 20 units, 1.75 milligram for 35 units, and 2.5 for 50 units. Strive provides insulin syringes, so it's a little 1 milliliter syringe. At 5 units is going to be 0.05 milliliters. 10 units is the 0.1 milliliter. On their syringe, they might get confused. It'll say 10, 20, 30, on up to 100. So if you want to give them 20 units, it's 0.2 milliliters or the 20 on the insulin syringe. You can see here 6 different vials, 3 prices according to different vials for patients and 3 for providers. They have a clinic price. This concentration is the same for all these, 5 milligram per milliliter. And they have a 0.5 milliliter vial, a 1 milliliter vial, and a 2 milliliter vial. Clinic pricing for the 2 milliliter vial is $175. It's $250 for patients. I typically will always give the 2 milliliter vial. I think that's the best cost savings. Because of the improved pricing for the clinic, it allows providers like you and I to offset pricing for patients, but also allow, from a business model, better income opportunity for providers in weight loss management. Tirzepatide, that typically starts out with 25 units sub-Q weekly, and then 50 units. Then it says 100 and 125. I recently had some patients say, hey, we're at 75 units. We like that dose. So if they come to me tirzepatide naive, I'll start them off with 25 units, have them go up to the 50, and then I'll follow up to see how they're doing. If they're just transferring over me to save cost or for whatever reason, it depends on what dose they've been on. This couple that I recently got into my practice, they were both on 75 units. They wanted to stay at that dose. And so I found out what they were being charged and kind of worked out a deal that would work out for both of us for them. I will make copies of these information sheets of these medications and also my pricing sheet to provide to help answer any questions. I hope this gives you a good outline and a good start. But like with any issue that a provider's treating, the best way to learn is to begin to acquire a few patients, and they will just naturally come slowly to you because you're just starting off. And as you acquire these patients and begin to treat them, then you'll gain more confidence and experience. Feedback I've received from patients, generally they're all very happy. As this one gentleman mentioned, he's, man, my joints are feeling better. I recently had a patient who, in addition to his weight loss and his happiness from that, he used to drink a lot of alcohol, and he no longer has those cravings. So it seems to take away some cravings. We know that in younger women, they're more likely to get pregnant on semaglutide, probably because of the improved hormone balance with the weight loss. But if they have PCOS, for instance, it's just going to improve their overall metabolism. I feel like from the experience with patients that I've had, that tirzepatide is generally better tolerated and is more effective at weight loss. So that's a discussion you can have with them as you're giving them different options. I hope this helps and gives you more confidence in the realm of weight loss treatment. Thank you.